This is Maricruz Bustamante, nurse practitioner with Catalytic Health Partners. And today I have
Carina.
Okay, this is Carina. So Carina, tell us a little bit about your current health, if whatever you are comfortable elaborating on. Okay, if you don't feel it, we can move on to the next question.
I have a traumatic brain injury. 5 years ago, I had a craniotomy. I suffered a quad accident, so I had a subdural and epidural hematoma in my brain. So they, like I said, did a craniotomy on me. So they removed this piece of my skull from here to here. Like you can see, I have an indentation in my skull. I spent a month in the hospital, and I spent 3 months in a nursing home. And I was really lucky that I had the neurosurgeon that I did. He is one of the top neurosurgeons in the country, Dr. Lomo. And he said that 90% of the people that suffer my injury die, and the other 10% don't talk or walk. I also fractured my inner ear, so I suffer from things like hearing, and I have like things like neuropathy and like you're gonna hear it like talking. I kind of have a cold right now, so
okay. Okay. What has been your experience with the services provided by Catalytic Health Partners, or CHP as we call it?
They come over and they do therapy sessions for me, like, which has been really helpful, because like I had like PTSD, and they've been really good about like reminders for me, because suffering a traumatic brain injury has been really helpful, like with keeping me on track, because I get told like you need to do this and you need to do that, and I'm not good about that. And it's like a one-on-one thing. Now that they've been gone, I don't have that anymore, and I've been really lacking of that. I have like a ton of things that I need to do. Fatima came over the other day, and we kind of talked about that when she had me come in, and I have like I still have like a couple appointments that I need to do, and I haven't done them. I have like short-term memory. Mm-hmm. I suffered a frontal and a temporal lobe damage. And I see a neurologist, and that was like one of the things that I needed to do, and like keeping a therapy session and having like Angel and the doctor come in, that kept me going and kept me healthy. Being a Latina, we're not ones to talk about things, and it was nice to have like that in home, and having a personal kind of keeps you sane, and makes you feel really good, and it was just very nice to have like someone to make sure you're okay. And it's really hard to get into your primary when you're sick, and especially someone like me, like getting the meds that I needed when you need a prior auth because of my medications. That was never a problem. When I needed something, I got my prior auths to come through like really fast. I just spoke with, you guys, and it was done right away.
So do you feel that you've made progress towards your health goals?
With you guys, definitely more so. Without you guys, it's kind of like one step forward with you guys, and then without you guys, 2 steps back. I can definitely say that. So, you guys are missed.
Aw.
The insurance I have now, I have to call them every time I pick up a prescription, because they keep thinking I have a primary insurance and it's their systems, and it's a new insurance, and it's really difficult because it's a new insurance, and so it's harder, you know.
Yeah, I understand. So CHP, how did they help you improve your health? I mean, was behavioral health, medical health? Was it
All of the
combination?
above, all of the above. Definitely all of the above. I can say that. All of the above.
All of the above. Good. And what most did you like about the services that were provided to you?
The personal level, like it was just healthier for me. Like very healthy. Like it wasn't like an issue for me to get anything through. Like having a traumatic brain injury, it wasn't like getting my needs met were it not difficult. Like, you know, there's always been like a how do I say, a language barrier for me. Like I had to relearn how to like get through everything. Like I had to talk better, and now like I have difficulty like getting things done, like getting my therapist and even talking to my neurologist. Like I find that people talk to me in my big word, condescending manner, you know, and that's not good.
Okay, what would you like others to know about our services, Catalytic Health Partners?
It was very you guys are just very personal, very it wasn't only like helping people in need. It was like other things, like, hey, you know, what's going on? Like, oh, how can I do this for you? Like, how can I you know, seeing like getting things accomplished, because there's other things that like affect people's health. Finding out what like it's an emotional, mental, and there's more what's involved in like what gets people sick, and you know that. So that's what happens that make people sick. And a true provider's gonna see that. And when we go to a doctor, or a neurologist, like I see a neurologist, I see all kinds of doctors. I see OBs, I see primary doctors, I've had like all kinds of, I've been in all kinds of locations, and there's so much coldness involved, you know, and everything affects your health. So when you come into a person's home and you're saying, hey, what is everything that is involving and what's making you actually sick, and you're trying to help them, you know, like, hey, this is gonna make you feel better. And that's what you truly are doing. You're trying to make them get better, you know. So that's what I think that's what you guys are, your core function is that you're actually trying to get, I don't know how, like, there's a difference involved. Like, and they're not looking at you like a cold provider. They're actually looking at you, and they're actually seeing you and being happy to see you. There's a difference. They don't look at you like a cold provider. They're looking at you as a family member. They're bringing you in, and it's a different thing. They're trusting you. You know, come in, let me feed you, what can I do for you? How you do for me, let me do something for you. Even if it's just, I don't have much to give you, can I do something for you in return? Even if it's like a glass of water, and that's all I have to give to you.
Oh, yeah.
So,
anything else you would like to tell us, Carina?
I was sad the day I lost you.
Oh. Well, you have our number.
I know.
You have our number. Call us, text us, reach out. We're there to help, okay? We're not just poof, gone. We're not. Reach out, please.